A rapid grower non-tuberculosis mycobacteria have 8 groups that are pathogenic and are weak gram-positive rod resembling diphtheriod uh, bacteria. M. fortitum, M. chiloni, and M. abscessus commonly encountered. These three account for approximately 90% of clinical diseases. M. fulvensis is a rapid growing NTM which usually grow before 7 days for incubation. This is the reason is used as a QC organism for rapid grower. Pigment production, M. kinsasi turn yellow after a few hours of a light exposure. Other such as M. semi may takes prolonged exposure to the light. Scrotochromogen produce the pigmented colonies even in the absence of a light. Colony often become darker when the prolonged exposure to the light. M. sulexi is scrotochromogen at 35 degrees centigrade, but in non-pigmented when grow at 25 to 30 degrees centigrade. Rapid grower that usually grow within 7 or before 7 days, and rapid grower there is this group is for identified on the basis of aryl sulfatase, which is if that is negative, then we go for the 45 degrees centigrade tolerance of temperature tolerance. Organism is S. sigmitis, and if it is not tolerated the temperature and the growth not obtained of 45 degrees centigrade, then it is M. chetai. Aryl sulfatase test, if it is positive, then we check for the nitrate. If the nitrate is also positive and organism also able to tolerate the NaCl, then we go for the further. If the NaCl is negative, then it is meningomyconigicum, which is catheter-related sepsis, involving the catheter-related sepsis. If organism nitrate is positive and NaCl is positive, mannitol is positive, then the suspected organism is Mycobacterium preginum. And if nitrate positive, further nitrate and NaCl also positive and mannitol negative, that is M. fortutum. M. fortutum is usually taken 2 to 4 days and found in the soil and water. Post-operative infection, grow on the McConkey, and iron uptake test is also positive for this organism. If aryl sulfatase test is positive and nitrate is negative and NaCl is also negative, then we suspected the Mycobacterium chiloni, which often grow temperature is 30 degrees centigrade. It take 2 to 4 days and mostly involved in the skin infections. M. abscescens is a nosocomial pathogen. This is NaCl positive, nitrate negative, and aryl sulfatase positive. The only two tests, aryl sulfatase and NaCl positive, is M. abscessus, which is a nosocomial pathogen. Rapid grower also produce the pigment. In this category, the pigmented organism is M. pili and M. vici, and all other pathogenic organism, which is M. abscessus, M. chiloni, M. fortutum, M. meningococcium, M. sigmitis, all of them are non-chromogen. Mycobacteria is non-motile acid-fast bacilli. It's a slow grower. It takes 2 to 60 days to the colony to appear on the plate. Mycobacterium tuberculosis complex have many other mycobacteriums like Mycobacterium tuberculosis, Mycobacterium bovis, Mycobacterium bovis BCG, Mycobacterium african, Mycobacterium mycoti, Mycobacterium kipri, Mycobacterium pinipedi. These all are in Mycobacterium tuberculosis complex. In Mycobacterium tuberculosis complex, they are capable of causing the tuberculosis, pulmonary tuberculosis. Mycobacterium bovis is exposed to the human by ingestion of contaminated milk product from the infected cow. And Mycobacterium bovis is little different from rest of the Mycobacterium tuberculosis complex species. Mycobacterium bovis required sodium pyruvate instead of gersolol in algae medium.
'Medium' to enhance the growth of Mycobacterium bovis.
To enhance the growth of Mycobacterium bovis. Mycobacterium bovis required sodium pyruvate instead of gersolol in algae medium. To enhance the growth of Mycobacterium bovis. Mycobacterium bovis required sodium pyruvate instead of gersolol in algae medium. Mycobacterium capri causes up to 30% of a human tuberculosis, most with the pulmonary manifestation in Europe. M. pinnipedi is transmitted from the sea lion to the human, result in the granulomatous lesions involving the lungs, pleura, lymph nodes, spleen. Non-cultivatable NTMs, non-cultivatable non-tuberculosis mycobacteria, or M. lepri is an NTM that M. lepri cause infection that is called leprosy. Leprosy is also called Hens disease that affect the skin, mucosa membrane, and nerve tissue. The M. lepri have two stages. Number one is the primary stage. It is a silent phase during bacilli multiply in the skin macrophages. It is a localized phase, and this is also called tubercular leprosy because in this phase the bacterium do not have immune defect, so the disease is localized. Intermediate phase in which the bacilli multiply in the peripheral nerves and begin to cause the sensory impairment, and this is also called lepromatous leprosy. It's a disseminated form. In lepromatous phase there is a defect in the mediated immunity which cause the extensive skin lesions, and these skin lesions have numerous acid-fast bacilli that spill into the blood, and that cause the bacteremia, and this way the organism is disseminated all over the body. Skin test lopramine is very useful. Preparation of bacterial antigen because of partial acid-fast property of M. lepri, fit Farco method of staining is widely used. M. avian complex is also non-tuberculosis MTM, but this organism have ability to tolerate the extreme temperatures, mainly involving HIV pandemics. Culture characteristics are opaque, translucent, or transparent colony morphology. Studies suggest that transparent colonies are more virulent and more drug resistant. In the M. avian complex, there is one organism, M. paratuberculosis, causes the John disease, inflammation of a boil disease in cattle and sheep and goat, and also found in the corn disease, which is caused by MRSA. Extremely fastidious requirement for M. paratuberculosis. Actually, they required mycobutyn. Mycobutyn is extracellular enzyme of M. pili and M. supraphyticus. M. supraphyticus and pili produce some extracellular enzyme that is called M. mycobacterium, and this organism required this factor, otherwise it will not grow on the media. Characteristic of non-tuberculosis mycobacteria classified as a non-photochromogen and considered as potentially pathogenic organism. In this chart, only the pathogenic organism, and that is also non-chromogen, are described. And the first one is Mycobacteria avian complex, which is mostly found in the natural water and soil. The infection is in HIV patients, a pulmonary infection, and the disease is disseminated. So M. zonopi is another organism in this group that is especially in the hot water tap, especially in the hospital, believed to be a transmission through aerosols. M. zonopi is primarily involved in pulmonary infection in adult, but it also can found in the bone, lymph node, sinus tract, and it's also disseminated disease. M. ulcerin. M. ulcerin, after M. lepri and M. tuberculosis, M. ulcerin is the most common pathogen in the human. M. ulcerin is found harbor in the aquatic insects, salivary gland, and infection occur in the tropical and temperate climates like indolent, cutaneous, and subcutaneous infection. In Africa, it is called Brolai ulcer, and in Australia, it is called Bracendal ulcer. M. ulcerin is typically the infection of a skin. Now, M. malbonis is majority of cases are England, Wales, Sweden, rarely isolated from the patient infected with HIV. its etymology is not that much clear up to date, but the organism is involved in the chronic pulmonary infection with also a pre-existing disease, cervical lymphadenitis in the children, and least common infection of the skin and Brosa M. Genevens is isolated from the pit birds, dogs. The mode of acquisition is unknown. Disseminated disease again with HIV and both non-HIV. M. hemophilum is epidemiology is unknown. Disseminated disease and immunocompromised patients, and mostly in pre-adolescence or early adolescent or cervical lymphadenitis in the children. M. shimodi and M. semi, up to date they are considered as the environmental. M. shimodi is not isolated from environmental sources, but M. semi is found in the tap water and the hospital water tank. Tuberculosis-like infection, both organisms are able to cause the disseminated infection. Mycobacterium tuberculosis can be cultured on artificial media. Levinson-Jensen medium, which is widely used, that medium contains the penicillin and nalidixic acid. The medium also contains the whole eggs. Glycerol enhance the growth of MTB. Glycerol is very important ingredient in this medium. Potato flour, salt, malachite green that inhibit the growth of other bacteria. Furthermore, medium is also introduced with the passage of time. These are a specialized medium. You can say it is an enriched medium because Middlebrook 7H10, 7H11 and 7H12 are available in both form, in broth form as well as in agar form. These medium contain the oleic acid, bovine albumin, glucose, catalase and 1% casein hydrolysate. In 7H11 it is added to improve the recovery of isoniazid resistant strain of M. tuberculosis. For identification of Mycobacterium tuberculosis and other non-tuberculosis mycobacteria, we use the biochemical test. And the number one biochemical test is nicene, nicotinic acid. It's Mycobacterium tuberculosis accumulate the largest amount of nicene. If a colony is buff color, slow growing and rough colony and nitrate positive, that is suspected to be a Mycobacterium tuberculosis. Another important test is nitrate reduction, a valuable test for the identification of tuberculosis, M. kinshasi, M. solexi and Fortutum. The rapid grower can be tested within 2 weeks, while the slow grower can be tested after 3 to 4 weeks of luxuriant growth. Catalase is also one of the identification test which is positive for Mycobacterium tuberculosis strain that is resistant to isoniazid, and these strains show up to 45 mm of positivity in catalase. M. gastri is also positive, but in a heat stable catalase test, Mycobacterium bovis, tuberculosis, gastri and hemophilum, all of them are negative. So another test is aryl sulfatase test. This test is a 3-day test, particularly useful for identifying the potential pathogenic rapid grower, because M. Fortutum and M. cheloni is positive in 3 days, and slow grower M. merinium and solexi is positive in 14 days. Aryl sulfatase is used to identify particularly the potential pathogenic mycobacteria. Another test that is growth inhibition test, it's thiophene 2-carboxylic hydrozate TCH. The only bacterium, Mycobacterium bovis, is unable to grow on 10 mg TCH. So this is very helpful test to distinguish between the M. bovis from M. tuberculosis. McConkey agar without the crystal violet is useful for identification of rapid grower like Mycobacterium Fortutum complex grow on this media, mostly used to identify the pathogenic rapid grower which grow on this medium from non-pathogenic rapid grower, the mycobacteria that usually do not grow on McConkey agar without crystal violet. Iron uptake test is also positive for M. Fortutum. In this test, they convert the ferric ammonium citrate to the ferric oxide, producing the red-brown rust colonies. M. cheloni is negative and fortutum is positive. These are used to identify the rapid grower. Further, pyrazinamide test is also very useful test. In this test, we can differentiate the Mycobacterium merinium and tuberculosis, that is positive in 4 days. M. kinsasi and bovis are negative in 7 days. Twin hydrolysis test is usually used to distinguish the slow growers, saprophytic Mycobacteria, from the potentially pathogenic, which is M. kinsasi, that is positive, and all the slow grower, that is saprophytic Mycobacteria, are usually negative. In clinical laboratory, we use two staining. One is acid fast staining, and other is fluorochrome. Fluorochrome stain and acid fast stain can be reported on the basis of the number of bacilli per field. If we see the doubtful results are if you have 1 or 2 bacterium, acid fast bacterium in AFB or in fluorochrome, and this is a doubtful result if you have 1 or 2 bacilli all over the fields, 300 fields. But if you have 1 to 900 fields in AFB and 2 to 1850 fields, that is considered of 1 plus. And the AFB stain, if we have 1 to 9 bacilli per 100 field in AFB and 2 to 18 in the 50 fields of fluorochrome stain, that is considered 1 plus. If we have 1 to 9 bacilli, but in AFB it is 10 field, and in fluorochrome the 10 field, in 10 field if you have 4 to 36 bacilli, that is considered 2 plus. If you have 1 to 9 per field and 4 to 36 per field in fluorochrome, that is considered 3 plus, and if you have more than 9 per field and you have more than 36 per field, that is considered 4 plus. This is biochemical chart for Mycobacterium tuberculosis and some of the pathogenic strain of Mycobacterium tuberculosis. We explained the positivity already, so this is just for the reference. Quality control measurement in mycobacteriology, we use the quality control strain, that is M. tuberculosis strain H37RB, which is widely used in mycobacterium for mycobacterium quality control for the growth purposes. For this organism, we prepare the dilution, which is approximately 10 raised to power 6 organism per ml, by adding the above cell suspension drop by drop to 1 ml of buffer until the barely turbid suspension occur. Transfer 0.5 ml of 10 raised to power 6 cells per ml dilution to 4.5 ml of glycerol brought to give the suspension of 10 raised to power 5 cells. And repeat the procedure to form the 10 raised to power 4, 10 raised to power 3 and 10 raised to power 2 organism per dilution, and then level all the vials and inoculated the desired organism on the culture medium. If we process the organism, like if we decontaminate the organism, and that is considered as a process, and if we do not use the decontamination procedure, that is considered as unprocessed. If 10 raised to power 4 colonies is unprocessed, then it will give us 3 plus growth, and 10 raised to power 3 will also give us 2 plus, and 10 raised to power 2 unprocessed mycobacteria will give us 50 to 100 colonies on the plate. But in the process, the 1 plus will be detected, like from the 10 raised to power 4 in unprocessed 3 plus, and the process will be 2 plus, and same in 10 raised to power 3 1 plus, and approximately 10 colony in 10 raised to power 2 are acceptable decontamination procedure. But if we use higher concentration, like media acceptable procedure, but it's too toxic, then the result must be in process specimen only 10 raised to power 4 will show the 1 plus growth, and 10 raised to power 3 and 2 dilution will have no growth, and that is showing that the media is acceptable, but the procedure is too toxic. And another is one more of the media is not supporting the growth of AFB when we don't have growth in 10 raised to power 2 or 10 raised to power 3 or 10 raised to power 4, or we have zero growth in unprocessed 10 raised to power 2. That is considered as that some of the medium or reagents are not as optimized to the procedure. This is actually the reference chart for all the biochemical tests. We discuss all these tests in one by one. The only distinguishing part for the tuberculosis from the rest of the M non-tuberculosis are the tuberculosis complex have rough colony, and rest of all non-tuberculosis have smooth colonies. Some of the rapid growers show the rough colonies also, but that mostly it is Asiaticum and fortutum complex. This is another chart in which the para-aminobenzoic acid is used 500 microgram per ml. If that is resistant and nitrate reduction is positive and Nicene test is positive, then we consider the organism is M. tuberculosis complex. This is the complete chart of slow grower, which is not discussed in this chart. That is further differentiated on the basis of catalase, twin hydrolysis. The positive one is 1 and the 2 is the negative, and further it is differentiated on the basis of NaCl, aryl sulfatase, beta galactosidase, twin hydrolysis, paraxenamides, which is explained previously. But I just want to aid the mark pathogenic organism which is most rapidly grower are positive for NaCl. In this cases, if you see here in twin hydrolysis, the potential pathogens are positive for the twin hydrolysis. Gastri is also explained here, Shimodi, and ulcerin, tuberculosis, which require the glycerol, which enhance the growth of tuberculosis. But in case of boys, we need the sodium pyruvate. Phytophracto method for lepri is widely used. Also got the Hens disease skin test with the lopramine is very useful in identification.